Well, thank you for joining us today for the Family Life Activity, Sun, Health, and Eating webinar, Updated Data Resources webinar. Any comments before we get started? I'll be muted upon entry and will remain muted for the duration of the webinar. If you need technical assistance, please contact the host using the chat panel. We encourage you to submit questions throughout the presentation using the Q&A or chat panel, and please make sure to select host when submitting your questions. Either will ask the questions on your behalf during the Q&A portion of the webinar. This is also being recorded and will be posted online in the near future. A link will be provided at the very end of this webinar. I'd like to turn the webinar over to our first presenter, AO.
Everyone, thanks very much for joining us virtually for this webinar. I'm planning to give a really nice overview on the FLASHE data resource that's publicly available for all of you to use for your research, and also some updates to the data resource that are available or will be available on the FLASHE website. So what we plan for you today is we have a series of speakers that will be giving specific updates around particular topics within FLASHE. So first, I will go over FLASHE just by way of background for those of you who may not be familiar with FLASHE or would like a refresher on what FLASHE is and what the data source offers. So I'll give an update on GeoFLASHE public use data resource. Third, we'll present some information on a new FLASHE imputed survey data set that's available for your use. And we will go to a presentation around the FLASHE adolescent accelerometer data that will be available as well. And we will close with a brief Q&A session. As Jennifer said, you can submit your questions online for that section. FLASHE. FLASHE is the Family Life Activity, Sun, Health, and Eating survey, and it was a cross-sectional survey that NCI conducted in 2014 to really examine the correlates of cancer preventive behaviors among parent and adolescent dyads. So within these dyads, parents and their adolescent child completed either a diet-focused survey, a physical activity-focused survey, which also included sun safety, sleep, and tobacco use items, as well as a module assessing parenting style and demographics. This is because at NCI we understand that cancer preventive behaviors include factors with a family environment, and particularly the adolescent and child relationship has a strong influence in those behaviors. Some of the dyads also completed within this study an adolescent accelerometer protocol, and that was an effort to collect some objectively measured physical activity data. It also included within the survey measures to ask about the home and school neighborhood locations, and those data were geocoded to offer geospatial analyses, and more information about that later in the webinar. But additional background in terms of understanding some of the goals around FLASHE, we are presenting here our conceptual model. The parent-adolescent dyadic relationship is a core feature of the FLASHE model. Here you can see highlighted in red the parent-caregiver factors, which I mentioned earlier, parenting style, parenting attributes, and the parent diet and physical activity behaviors themselves. And we examine how those behaviors may be associated with adolescent-level factors, their own attitudes towards food and physical activity, the influence of peer and social support on those behaviors, and some of their decision-making processes. Multi-level approach, we understood that we wanted to examine some of the home environment factors, such as food availability, family meal times, as well as community and neighborhood characteristics, including the grocery stores that might be available, sense of safety, and the built environment. You can see here we have our outcomes of adolescent and as well as parent or caregiver dietary behaviors which were assessed, as well as physical activity, safety, sleep, and tobacco, as consistent with our name. The study was a web-based survey, and it pulled from a national sample of based from a web panel, but it is not nationally representative. The core features included the dyadic design, so the parent adolescent had to consent to participating in the survey, and they did receive those two surveys of either a diet or physical activity focused survey. They're randomly assigned into either the survey-only group, just received the diet and physical activity survey, also into the motion study group, where they received the accelerometer. Here on this survey, on this slide, you can see our enrollment and completion rate, which is 38.7%. You can see the survey-only group, the completion rate of 85.6%, and the motion study group was a 58.7% completion rate. For the overall analytical database, we have access to 1,479 completed dyads with an overall response rate of 29.4%. On the site, we can find cancercontrol.cancer.gov/FLASHE. You can find a list of data user resources. Not only will you find the actual data sets available to you, but annotated surveys, codebook, construct tables, which list all the different survey items, as well as some references for those survey items. You can see how those items were selected, references, a methodology report, a data user's guide, as well as a linked dyadic and analysis resource page. So for those of you who may not have a background in dyadic data analysis, you can go to the website and find more information about how to conduct those types of analyses. We have available the link to the June 2017 special issue in the American Journal of Preventive Medicine, which provides some more background on the data set, as well as some examples of how the data set have been used to answer specific research questions. I encourage all of you to go to these resources. They're available to you, and we do have contacts in case you do have any additional questions. But they really help you understand how the data were collected and how you can use them for your own research. We did have some earlier webinars that provide some more details on specific content areas within FLASHE. So you can go here to this website for the dyadic analysis webinar, as well as a webinar that we had previously that provides some background data around FLASHE. As I mentioned today, we'll be covering the content that's highlighted in this slide in red. First, the physical activity survey and then imputed data for 8 of the variables within that survey, which then allows you to do some further analyses. Accelerometer data that are going to be available, as well as the GeoFLASHE data. This webinar. FLASHE data, survey data continue to be used in 2018. And this is cross-sectional in nature. It allows for many hypothesis testing. So we've seen a great growth in publications, conference presentations, dissertations, and theses that have been able to use FLASHE, and not just the data, but even using some of the measures that are available within the survey. It's a great opportunity to look at some of the measures that we have used and see how it could be used in your own data collection efforts. You can do dyadic level analysis. With data, you can also look at adolescent-only analyses, or parent or adult-only analyses as well. So you can look at food and vegetable intake, energy-dense, nutrient-poor foods and sugary beverages as outcomes, as well as physical activity behaviors and barriers, indoor-outdoor tanning, and also sleep behaviors and varied behaviors. I do is just highlight some additional ways that FLASHE data can be used. I will transition now into the GeoFLASHE public use data. As previously, this is our conceptual framework for the FLASHE study. And you can see here that we had community neighborhood environment as a core area within the FLASHE conceptual framework. We understand that context matters when we're thinking about behaviors and behavior change. And also recognizing that there is a difference between self-reported environmental factors as well as objectively measured factors. So we understood that perhaps a research community, there would be research questions that would be interested in examining the actual geospatial component or the objectively measured features of the neighborhood environment within which our survey sample lived. So FLASHE, we sought to geocode the actual data. So that would be the participant home as well as the adolescent school address data. The community could do those sort of analysis. analyses. Within the demographic survey, we asked parents two sets of open-ended questions about the location of their home and their adolescent school, and those are listed here on the slide. Can you tell me what the name of the street or road that you live on? As in follow-up, because we were concerned that there may be some concerns from respondents about privacy, we asked them, what's the name of the nearest cross street or road? We also asked a similar question regarding this adolescent school. Can you adjust the name of the street or road of the teen's school and the name of the nearest cross street or road? While we're concerned on our end that there may be some concerns about privacy with providing address information, we did get a pretty good response on these questions. And we were able to geocode 90.9% of the parent home address and 2.8% of the adolescent reported school addresses. We excluded those who didn't respond or had missing those responses on those two questions I mentioned previously, as well as those who reported that they were homeschooled. For the school address information, if someone is using GeoFLASHE data, instead of using the school address information, they would use the home address. We had those who, with the geocoded, anyone who reported the street name, and we were able to geocode that information. The geocoding, we're actually put within using ArcGIS point for the home as well as school address to protect the privacy of our respondents. We did buffers based on assumptions of walking 10 to 15 minutes at an average pace of a 20-minute mile based on prior research. Buffer we're calling as sort of a proxy for a neighborhood conceptualization. Here are some examples of what a buffer could look like. As you see on the left hand of the slide, these are circular buffers, and these were based on those assumptions that I mentioned. But we thought perhaps adolescents and adults, depending on their age, have a different pace and may stabilize their neighborhood at a different scale and scope, depending on the behavior of interest. The greatest amount of flexibility for our data users, we created circular network buffers based on 400, 500, 750, 800, 1,000, and 1,200 meters from participants' home. We also calculated street network buffers, and those are the buffers that you see on the right hand of this picture. It's a little bit more jagged. The buffers are based on would imagine the distance traveled from the center using roads rather than in a buffer where it's as the crow flies. So you see how a buffer, someone might have to walk through, say, for example, a physical barrier like a building or a highway, whereas in a street network buffer, it's conceptualized based on their ability to distance based on the ability to walk using the street network. Conceptualization of buffers for neighborhood. We related specific neighborhood measures. So these include SES, built-in mental characteristics, UV exposure, urban-rural location, and distance from home to school. I'm going to provide now a little bit of background on how those measures were calculated. So first, what we did in step one was to identify the overlap. Within this image, you can see the dark green area is an example of a 400-meter buffer. And what we did is we calculated the overlap of the census tract, the U.S. administratively defined census tract within that buffer. We calculated the buffer percentage that overlapped. And then in step two, we used that buffer percentage overlap as a weight, calculated a weighted percentage based on what was provided in the U.S. Census for a particular measure. In this example, we have applied this weighted percentage calculation to calculate the percent Hispanic for this within this 400-meter buffer. This is how we calculated the measures for neighborhood. You will see online that we will have a specific methodology report, where you can look into more detail about how all of these measures were calculated. For now, I'd like to share the neighborhood walkability factors that you can find within GeoFLASHE. You'll find that we have a calculation for walkability-related factors based on the literature, which is high density, older home, and short commutes. These are some of the measures based on the census that we pulled. Socioeconomic status, this was based on the Yoast index, and that we have here listed on the slide the SES domain that was captured, as well as the corresponding U.S. Census variable that we use to measure each domain. You'll find further information about this if you look at our methods report. A website that provides the information that you'll be looking for if you want to access the GeoFLASHE data. Here you'll find that there's a code book, the methods report, and the FLASHE data available in SPSS as well as in SAS data files. To transition to Dr. Betty Liu, who will find more information on the FLASHE imputed survey data that's available.
Thank you, everyone. Good morning. I'll talk about the imputation data we did for FLASHE, just an overview, taking time. So data, due to a system error in physical activity survey, a little bit over like 50%, 53% of the respondents had 8 variables for meeting. Those 8 variables are parents reported life goals for their adolescent children. The missing was accounted for in the group of parents that had received the physical activity survey second after completing the diet survey. The identified system error did not enable those parents to accept the 8 questions. Therefore, to reduce the potential bias due to those missingness, and also to enlarge the statistical power, we considered multiple imputation to impute the missing data for those 8 variables. However, as we know that if those missings are missing completely at random, then no imputation is needed. For before doing imputation, we tested whether those missing data are missing completely at random. We used cross-tabs and the catch-word test, the missing skip pattern, and the set of parent social demographic variables. Shows that missing skip pattern was not completely independent from the parent gender and the work status. This might be due to the design of this survey. Table shows lists 8 variables that need to be imputed. As I mentioned earlier, those are the self-reported parent-reported life goals for their adolescent children. For the first 5 variables, we used a 5-point Likert scale. The values varied from not at all important to extremely important. For example, the first variable asks, when a teenager is an adult, he or she will feel that there are people who really love him or her. Then the parent answered, it's not important at all, or like, it's extremely important to me. And the last 3 variables on this table is a yes or no question. All of those are either categorical or basically binary variables. So we considered 2 types of imputation methods. The first one is sequential regression imputation method, which was implemented using IVVAR to simultaneously fill in those item missing data.
The second method is the weighted sequential hard-data imputation implemented using STAR11. So for second method, for the weighted sequential hard-data imputation, requires defining a set of categorical variables that determine the imputation classes. So we use the parent social demographic variables to form the imputation cells. For the first method, the sequential regression imputation method, those social demographic variables are used as covariates. So the first method is regression modeling based imputation. For multiple imputation, typically the literature recommends that 5 sets of multiply imputed data would be enough. However, recent research shows that if the missing rate is high, we will need more than 5 sets of multiply imputed data. For our data, we had 53% of missing data. So we did some sensitivity analysis based on 10 sets, 20 sets, and 50 sets of multiply imputed data. And the evaluation results showed that 20 sets of multiply imputed data is reasonable. Because we try to choose one method among the 2 imputation methods we did. We considered, so with 20 sets of multiply imputed data for both imputation methods, the sequential hard-data imputation consistently showed better results in terms of several evaluation criteria compared to those of the sequential regression imputation method. But just so it really depends on what criteria you are focusing on. You use different criteria, your evaluation results may be different. But our focus, the sequential hard-data imputation, do show better results. So before imputation, for some of the categories are very small, so we cluster the very small categories with the next closest category to enlarge the samples within each value to ensure the imputation model converges. So to further evaluate which method is better, we conducted a simulation study using the 826 respondents fully observed data. So we generated simulated data mimicking the original missing patterns because with 800 some respondents, the data for the 8 variables are fully observed. So then we randomly set some of the values are missing, but making the original missing pattern. Then we run imputation using the 2 methods for each set of data. Eventually, we computed the percentage of relative bias coverage rate. So it shows that the weighted sequential hard-data imputation again shows better better results in terms of relative bias and coverage rate. Then we eventually choose the weighted sequential hard-data imputation as our final imputation method, and we created 20 sets of multiply imputed data. All those multiply imputed data were set in one data set, but there's a variable named mark with values varying from 1 to 20 can be used to separate the 20 sets. All the details about our imputation is given in our 2018 paper. For our interested, you can read the details from this paper. So to analyze the multiply imputed data is the case. So basically, one needs 3 steps. The first step is to analyze each of the 20 completed data sets separately using methods and software appropriate for the FLASHE data. The next step is to extract the point estimate and the estimated standard error from each analysis, from the 20 analyses. And finally, you need to combine the estimates and standard errors using Rubin's combining rules to arrive at a single point estimate, standard error, or interval or significant test, depending on your analysis goal is. So I listed the Rubin's combining rule on the right. If you want to, the final point estimate is the average of the 20 point estimates you created from each imputation data set, and then you want to compute the associated variance, which is the sum of the within imputation variance and the between imputation variance. But you don't sum them directly. There is a 1 plus 1 over m. M is the number of multiply imputed sets. In our case, m equal to 20. And then you can compute the confidence interval using the nominal confidence interval, or if you want to use the interval. Really depends on your analysis goal. The final slide shows the example code. Here we use SAS callable Sudan and the SAS proc MI analyze. So basically, the first part, I use proc cross tab for this. Simple example really is the percentage of computing the percentage of value which each category in this TTF law variable. This one, after combining the first 3 categories together, this recoded variable only has 3 categories from 3, 4, 5. So I wanted to compute the percentage of each value, percentage of people who answered each value in this. So use cross tab. I use the class. Use a class statement. We compute the 20 sets of point estimates directly. Really don't need to separate the 20 sets. But for some analysis, you need to separate them. Really depending on which analysis you want to conduct. And then finally, after running the cross tab, I output the results into a data file, and then the next step is to keep only the results I want to keep, the point estimate and the standard error. And then eventually, I use proc MI analyze to combine the point estimate and standard error into the final value, that the value you need, analyzing the multiply in data. But you can use other analysis procedures to go through the same combining rule. Depends on the analysis plan you have, but the combining rule should be the same. Yeah. Thank you very much.
Have controls of the presentation now.
Okay, thank you. So I had the opportunity to be involved in the motion study of the FLASHE project. So I was in charge of processing the Accelerometer data. So I'm going to provide a brief overview of the data set that's going to be released as part of the FLASHE project. So given April has already provided some specific details about the methodology and the FLASHE study as well as the motion study, I'm going to focus on describing the specific data set that we are going to release as part of the motion study. So we received the valid data files from 561 adolescents. So those are ActiGraph GT3X plus data. Each of the adolescents was asked to wear the GT3X plus monitor on the dominant wrist over a 7-day period. And accelerometers were sent and received via mail, and each of the accelerometers was set at a sampling rate of 100 Hz. and GT3X plus data using two parallel sets of processing methods. So basically, we first processed raw acceleration data and also processed activity counts data. And all data were processed in 5-second epoch length. So we processed the raw acceleration data, so raw data using GGIR method, which is a freely available R package program, and we used two comparable sets of activity counts processing methods for processing activity counts data. So, for example, we used two methods using vertical axis like a VA and vector magnitudes, so VM. We also applied two Chandler's methods, so Chandler's method using vertical axis and Chandler's method using vector magnitudes. And this is the cutoff points that we use to classify different intensity categories, so entry behavior, light, moderate, and vigorous. You can see the cutoff points for each of the 5 processing methods. And as I said, we use the GGIR for processing raw acceleration data and 4 processing methods for processing activity counts data. Release 4 different data sets. So first, the data set would include the list of processed variables. So the list of processed variables include the ID variables and some of the basic summary variables from the active graph accelerometers, and also average MO variable from the acceleration data. And we're gonna release 3 separate data sets. So one for quad variables, one for Chandler's variables, and one for GGIR variables. And each of the 3 separate variable data sets would include the list of processed variables. So on to the first data set. So we are going to include accelerometer ID and the participant's ID. And also we are going to include time stamp variable, which is the time variable obtained from the active graph accelerometers. And we extracted the date variable from the timestamp, and also we calculated the day of year variable indicating a specific day of year. So for example, it ranges from 1 to 365. So 1 indicating the 1st of January and 365 indicating the 31st of December. And also we extracted the time variable from the timestamp variable, and then we calculated the mean of day variable, which is indicating a specific minutes of a day. So for example, it ranges from 0 to 1339. So 0 indicating midnight of the day, and 1 for the first minute of the day, and 2 indicating the second minute of the day, and so on and so forth. And we also included axis 1, axis 2, and axis 3 variables, all of which are activity counts, included vector magnitude variable and the logs variable. Also, we calculated the MO average value that's corresponding to each of the to each 1 minute time interval. So MO is essentially a summary score of the 3 axes based on acceleration values. So we calculate this variable using the GGIR method. And we included the time zone difference variable, which is indicating the difference in time between geographical locations and the data set. So we included 2 parallel sets of variables. So the first set is using vertical axis activity counts, so VA. So you can see the Crowder sedentary VA, Crowder LPA VA, Crowder MVP VA, Crowder MPA VA, and Crowder vigorous physical activity VA. And we created a similar set of variables using vector magnitude values. So all these variables are expressed in terms of a proportion. So for example, if you look at the first variable, so Crowder SED VA, it indicates is a proportion of the corresponding minutes defined as sedentary time using Crowder's vertical axis cut points. So for example, if the value is 0.5, then what it indicates is that 30 seconds of the 1 minute interval were spent sedentary. And if it was 1, so 100%, then it would indicate that the full 1 minute interval was spent being sedentary. And if it was 0.75, then it would indicate that 45 seconds of the 1 minute interval were spent being sedentary. So we apply the same logic to all the other variables and all the other data sets as well. So you see that we also calculate the 10 separate variables using Chandler's vertical axis cut points and Chandler's vector magnitude cut points. And they were all expressed in terms of proportions for the GGIR variable data sets. And I'll give you like an overview of the research paper that we published all together in American Journal of Preventive Medicine. So in this paper, what we did is that we compared data between raw acceleration values and activity counts. So as I said, the active accelerometers were placed on the dominant wrist for 7 days, and we processed both raw acceleration data and activity counts data using GIR and the 4 activity counts processing methods. The specific cutoff points to be able to classify different intensity categories and some data reduction procedures. And it resulted in a final sample of 408 adolescents in the final analysis. Moving to the results. So we first looked at the sedentary time between the 5 different processing methods. So GGIR for raw acceleration data and the 4 specific processing methods for activity counts data. And see that based on the GGIR method, the sedentary time estimate was around 650 minutes per day. But if you look at the other activity counts processing methods, you see that Crowder methods use substantially smaller estimates of sedentary time compared with the GGIR method, and Chandler's methods provide a substantially larger estimates of sedentary time. And there was a little difference between boys and girls. When it comes down to MVPA comparisons, you see that all the 4 activity counts processing methods provided considerably larger estimates of MVPA time compared with the GGIR method. We looked at the same comparison in case between different age ranges. So between 12 to 14 years old children and 15 to 17-year-old children. And the general pattern of differences between the different processing methods was almost identical to what we just observed in the previous slide. So basically, a smaller amount of sedentary time when processing Crowder method and larger estimates of sedentary time when processing the Chandler's methods. So a very similar pattern of differences was identified for looking at MVPA comparisons between different age ranges. So when we looked at the differences, in this case between normal weight children and overweight or obese children, difference between these 2 weight status groups was really small, but you see that the pattern of differences between the raw acceleration data and the activity counts data were almost identical to what we just observed. So these are references and materials that I used for this presentation for processing of the active graph accelerometer data. Very much.
Great, thank you, Young-Won. And now with that, I'd like to jump into Q&A from our audience. As a reminder, you can ask a question by typing it into the Q&A or chat box and selecting host. A moderator will ask ask the question on your behalf and direct it to the speaker that question is aimed for. And with that, we'll start with some that we've already received prior to this webinar and so far in the webinar.
Good evening, everybody. My name is Linda Nebling. I'm from the Behavioral Research Program. The FLASHE project has been ongoing for a number of years, and we're very pleased to provide these data for public use and access. The questions that we've received thus far is the urban and rural data available in the GeoFLASHE data set, and what other types of information might be available in GeoFLASHE.
Great question. So this is April O from the Behavioral Research Program, and I can jump in and answer that question. So we do have an urban-rural variable that is available in GeoFLASHE. We have that variable available broken down by city, town, urban, rural, suburban, and that information is available in the GeoFLASHE codebook. Other variables we have available are around UV exposure, as well as some built environmental characteristics, using the census data as a source of those variables. We also have some variables available around demographic characteristics of a particular buffer or census tract area, including population density, net renter, median household income, and then we also have some other demographic, such as the racial ethnic percentage breakdown.
Terrific. Let's see, hold it. Sorry, laptop is touched. Are there a list of ongoing FLASHE publications or projects? Brief. The answer is yes.
Yeah, so this is Laura Dwyer. I'm a contractor to providing support to the Behavioral Research Program. Yes, the answer is yes. If you're interested in receiving an updated list of FLASHE publications, you can definitely reach out to us, and we're happy to provide you with a PDF list. You can email there's a FLASHE study email address, nciflashe@mail.nih.gov, which is also mentioned on the FLASHE webpage, and you can contact us, and we'd be happy to provide that. While we do not require approval of a particular project idea prior to use of the data set, so you can go on the FLASHE data user page and download the data for your use type of analysis that you have planned. But if you have any questions about if a project in a particular area is ongoing that we know of, we're happy to answer questions of that nature as well. Also by contacting the FLASHE email address.
Terrific. Thank you, Laura. All for folks to be aware, a number of publications have come forward from both our partner in FLASHE, the FLASHE study team, as well as other outside users. So we encourage you to take a look at the list that we're aware of if you're thinking about some research directions and type of analyses. Particularly areas in the dyadic data analyses are still widely available for consideration. So that's something that would be very opportunistic for your consideration. Our next question is asking about funding opportunities. Does NCI or are there NIH funding opportunities available for incorporated dyadic data analysis or secondary data analyses? And we can make available a list linked to what we have for current funding opportunity announcements. The NCI does not have a specific FOA dedicated to data analyses from the FLASHE study, but there may be some aspects to the data analysis you're interested in doing that could fall into some of our ongoing areas of program announcements that would be quite relevant for your interest. So if you have a specific question about a funding opportunity announcement that you see, and could you use FLASHE data as part of that ongoing work, we would encourage you to speak to the program officer contact from the NIH that is generally associated with a specific funding opportunity announcement. Or you can also, again, send inquiries specifically on a particular funding opportunity announcement to us directly. And we also have been asked, are there any plans for further expansion of the cancer prevention behavior among dyads? And at this point, we are very pleased to indicate that in development is a FLASHE partners-focused research endeavor. And this would be associations between partner dyads in household, could be married or just, cohabitation or general partnership, rather than a parent-child relationship. The particulars are still under development. So again, if you have some interest or interest of research questions, you're welcome to send to us again to our FLASHE website as we're in our development stage process for this. So basically, until we have things rock and rolling, I can't talk about it anymore. But it's something that we've been very seriously working on and hope to have a field in the next year or so. The next question is, we have access to the original GeoFLASHE data?
That's another great question. This is April O. In the Behavioral Research Program. So please tune. I guess that is a short answer to that. Follow us at NCI Behaviors on Twitter, and also please do continue to check our website. We are in the process of exploring what ways we can allow that data to be released in a way that protects the privacy of our respondents, while also allowing for some further rich analyses, whether it is merging your own geospatial layers that you might have access to, or calculating additional measures. So please stay tuned. Our goal is to try to make some sort of data layer available.
Thank you. Question here that one might be really prone for answering. Use annual average daily traffic data for exposure. Would like to add to the network geo model. Any ideas?
That's related to the GeoFLASHE data?
I think that, again, if we go to having a spatial data layer available, which our plan is, we're looking towards that through future activities, then hopefully a user would be able to merge that sort of data as well.
So a thing that we're working on but don't have available at this particular point in time. So again, referencing back to continuing to monitor our progress, Twitter and our website, so that as we develop more resources for your use, we can let our community know.
Those are most of the questions that we've received during this webinar. Again, we'll keep the chat and Q&A open a little bit longer, but did want to give you some resources that are now up on your screen. If you have any questions following today's webinar, please feel free to contact the NCI FLASHE at nih.gov email address. Our presenters and speakers would be more than happy to address any comments or questions that come up following today's webinar. Receive more information, please sign up for the listserv. The link to sign up for the e-newsletter is on the screen as well, along with where the webinar will be archived in the near future, along with a list of Q&A. And that, seeing that we have no other questions that have come in, I want to thank again our speakers for a great presentation on an overview of the FLASHE data, along with audience for some of the great questions they submitted. And again, feel free to keep the conversation going. To everyone.